All right, last video, we're going to talk briefly about some exercise. Now that you've got your surgery scheduled, you should have built yourself up to where you're getting some exercise in 4 days a week for about 30 total minutes. So if you're struggling to meet that goal, please reach out to me and I can help kind of give you some tips to get you going. I know the nurses have already talked about the importance of getting up and moving around right after surgery. The more that you're up and moving, the easier it's going to get, the better you're going to feel, and it's going to help prevent complications like bronchitis, blood clots, things like that from developing. So it's very important that you're up and moving right after surgery. The key is to just do a little bit often. You don't want to get up and overdo and then lay around for a long period of time, to try to recover. So a little bit often. When you're in the hospital, as long as you're feeling okay, you're not lightheaded, you're not dizzy, feel free to get up and move around your hospital room. You can do some laps around the nurse's station or go back and forth down the hallway. If you're not feeling well, if you are lightheaded, if you are dizzy, then don't hesitate to reach out to a nurse and they'll come in and help you get around. Same thing goes for the when you go home. The goal is to just do a little bit often. So I usually suggest that you make a path inside of your home, and every hour that you're awake, you just get up and do a lap or two, in addition to going to the bathroom and fixing your protein supplements. And then eventually you'll start feeling a little better. One lap will turn to two, two will turn to five, and then you'll kind of get back into your day-to-day. All of your activity is just basically going to be as tolerated after surgery. We really ask you to just not do three things. So we don't want you doing any heavy lifting, and our version of heavy is about 20 to 25 pounds, so nothing over that. No water exercise and no abdominal exercises until your incisions are healed. So we don't want you doing anything that's going to aggravate your abdominal muscles. We don't want you getting any type of water that has any chemicals in it until those incisions are healed. We all heal a little bit differently. So for most of us, that's going to be about 2 to 3 weeks. If you're currently doing some of these activities, if you're in a water aerobics class, if you're doing some planks, if you're doing some strengthening exercise, when you come in to get your staples removed, talk with your surgeon about that, and they can kind of guide you as to when you can kind of get back into those activities. Otherwise, you're just going to start progressing your routine. So you're recovering from surgery, you're learning how to get the protein supplements in. It's going to take a little time for you to build your endurance back up. So don't be discouraged with that. The goal is still going to be about 30 minutes of exercise 4 days a week. But for example, if you're walking, you may not walk as fast. You may not walk as far as you were doing before surgery. So if you're doing 30 minutes all at once right now, you may break that up into 5 or 10 minutes spread out throughout the day. The other thing that I would advise you in, if you are doing some walking or you're going outside, remember, you're still recovering from everything. So you may feel really good. And then once you get started with your activity, your energy may zap a little bit faster than you're prepared for. So if you're going for a walk in the neighborhood, just kind of make sure that you stick around close to home. I don't want you to get all the way out in the middle of the neighborhood and then, have to phone a friend to get back home. So just build your endurance up. It'll come. I'm going to see you in the clinic periodically after surgery. So I'm scheduled to meet with you at your 1-month follow-up, your 6-month follow-up, and then yearly as needed. I'm here full time, so if you happen to be in the clinic and you have a question for me, don't hesitate to just ask, and I'm happy to pop in and talk with you while you're here. You'll also have my direct phone number and email, so anytime that you've got any exercise or activity questions, don't hesitate to reach out to me. In addition to touching base with you when you're in the clinic, I am available for individual appointments as well, so just get in touch with me for those. We do have a small gym here in the clinic, and most of the individual appointments are to just kind of give you a little bit more one-on-one advice in regards to how to get started with some exercise, or actually show you what to do so that you physically try it and you understand the right form and the amount of weight and things of that nature. Before surgery, we do try to get you on a scale called the Tanita scale. It's a little bit more complicated than just the regular scale that you typically get on when you're here in the clinic. This checks your body fat percentage. It's a bit of a pain. You do have to have your shoes and your socks off for this scale, and they will ask you if you have any type of pacemaker or electronic device. If you do, we'll probably not get you on the Tanita scale. We'll just opt for the regular one. But for the Tanita scale, before you step on, you do have to have your shoes and socks off. You step on the scale, it will get your weight for today, and then it's going to ask us to enter in some information. It wants to know whether you're male or female, how old you are, how tall you are. It will get your weight, and then it sends just a very small electrical current up one leg and down the other. It's very light. You shouldn't feel a zap or anything, but that's why we ask if you have any type of electronic devices. It's not safe for you to get on there with that. So electricity is attracted to water, and everything in our body has a lot of water in it besides fat. Fat doesn't carry much water. So that electrical current goes faster and stronger through what we call our fat-free mass. Our fat-free mass is just everything in our body besides fat. Muscle, bone, blood, skin, all of those things tend to have a lot of water in it. The electrical current's going to go slower through our fat because fat doesn't have as much water. So the computer just takes all of those factors, puts them into a formula, and estimates our body fat percentage. Now, a lot of people do get body fat percentage and body mass index confused. So I just want to go over that briefly. Body mass index, or BMI, is what we've paid attention to up until this point. It's one of the things that the insurance companies look at to see if you qualify for weight loss surgery. Body mass index is a ratio of your height and your weight. So as we gain weight, our BMI goes up. As we lose weight, our BMI goes down. Now, body fat percentage that we'll estimate with this Tanita scale is more of the percentage of our body weight that is made up of fat. So as we gain weight or as we lose weight, it doesn't always reflect on the body fat percentage. One of the things that we need to remember as we're losing weight is that we're going to try to keep as much muscle as we can and promote as much fat loss as we can. Now, the more that we weigh, the more muscle we have to carry that weight around. So as we're losing weight, we really want to make sure that we're working that muscle so that we don't lose it. And that's one of the main reasons that we do tend to focus more on some strengthening exercise, specifically right after surgery as you're losing that weight the quickest, in order to help promote more fat loss and maintain more muscle. So body fat percentage is the percentage of our body weight that is fat. You can come in for a follow-up appointment, and for example, we'll get you on the scale. If you lose 30 pounds, then referring back to your body mass index, we know that your body mass index or your BMI will go down. But if you lose 30 pounds and we get you on the Tanita scale and we start looking and we see that even though you've lost 30 pounds, 15 pounds was fat and 15 pounds was muscle, then even though your body mass index is less, your body fat percentage would be exactly the same because you lost evenly between fat and muscle. So the goal of using the Tanita scale is to help monitor your weight loss, to make sure that as you're losing weight, you're losing fat, you're maintaining muscle in order for that body fat percentage to go down. So a couple of the things that we're going to be tracking while you come in for your follow-up appointments, we're looking for your body fat percentage to go down as you lose weight. We're going to try to maintain as much muscle as we can. Now, like I said, the more that we weigh, the more muscle we have to carry that weight around. So if you lose that 30 pounds and you're not doing something to keep that muscle, you will lose that muscle. So it's very common to lose some muscle when you have a significant weight loss, but our goal is to try to keep as much of that as we can. The Tanita reading will give us your metabolic age. So your metabolic age is based on our metabolism. Our metabolism is based on the amount of muscle to fat ratio that we have. So as you're losing fat and as you're maintaining muscle, your metabolic age will go down closer to your actual chronological age. So don't freak out if you look at your metabolic age and it's really high. That's okay. We want it to go down. Visceral fat is the fat that's located more around our internal organs, and we're looking for that to go down. A high visceral fat rating is linked to a greater chance of more disease. So the more that we can get that visceral fat rating down, our goal is to get it around 13 or less. So we'll be monitoring that as well. The Tanita reading will give us an estimate of your long-term goal. So we'll get your baseline before surgery and then be working towards that long-term goal. The long-term goal is based on your gender and on your age. Looking at where you are for your body fat percentage before you have surgery and looking at that long-term goal, it can seem like a really big goal, like, oh gosh, I'm never going to get there, but it happens. I see patients get within their target body fat percentage ranges all the time. For a gastric bypass, that could be as quick as a year to a year and a half. For a gastric sleeve, it's typically more of a year and a half to 2 years. So remember, this is a marathon, not a sprint. You're never going to lose weight as quickly as you want to, but just keep your eye on the prize. This is my direct phone number and my direct email. If you have any exercise questions at all, don't hesitate to reach out to me. I'm the manager as well, so if there's something that I can do to help you along the way, please let me know. It was good to see you. Let me know if you have any questions.